Welcome to Community Connections with Children's Services Council, St. Lucie County. I am just one of your hosts, Sean Boyle. With me is...
You have to stop laughing through the opening.
It's because I messed up the word community again.
I'm Ashley Mock, but...
And I was just going to go straight through because I didn't want to edit that part out. But
no, you're good.
Welcome to the inner workings of our radio show / TV show, because once a month, thanks to a wonderful partnership with WLX-TV, the St. Lucie Public Schools channel, we are a little radio program that is monthly, just to confuse everybody, is weekly, on 104.5 The Flame at 10 a.m. every Sunday, also becomes this wonderful TV show.
Yes.
So if you're listening to us on the radio and you want to know what these radio faces look like, with caution, proceed to YouTube, look up WLX-TV Community Connections, or check out their Facebook page at WLX-TV, or by all means, check out their airing on your local broadcast cable company. That's fair, right?
It is. There's many different ways to find us.
You really kind of threw me off on this episode.
Sorry.
So
I tease you when you do it on the radio show, too.
So why we have this television program, besides to tease each other, is to talk about what resources and things that are available for children and families in St. Lucie County. Now, we at the Children's Services Council, clearly not being radio show host professionals or TV show, we do 5 things for our community. And those 5 things are: 1, make sure every baby's a healthy baby; 2, stop child abuse before it happens; 3, keep kids off the streets; 4, keep them in school; and 5, keep them off drugs, alcohol, and other risky behaviors by offering programs and resources, 50 in total, to all families in our community.
Just making sure you got all that.
I could see your head nodding in my peripheral vision.
So of those priority areas that Sean talked about, he mentioned there's 50 programs, and there's a couple different ways that you can learn about those programs as well. One of them is on our website, which is cscslc.org. We have a full list of our programs there, along with contact information, direct links to get to their websites to make it easy. And in addition to that, we've been posting success stories from those programs too. So I mentioned on the radio show a couple weeks ago, we've had a great story from a young man who's participating in the ARC of St. Lucie County, has a great after school and summer program. So there's a great story about him up there, and we'll continue to do that throughout the year. So it's a great way to kind of identify exactly what is happening in those programs and learn about the successes that those kids are having.
Now, you said a couple of ways. That's just one.
It is. I see you brought a prop with you today.
And there's more than 2.
We also have a printed guide of those programs, and we call that our Family Guide to Programs. And it's a very simple printed copy of basically the same information, a list of all the programs, contact information to get in touch with them, and a brief description about what they do. But we distribute these all over the community, to schools, to businesses, to organizations, to churches. It's got really just a ton of information in it, and it's a really helpful guide for people who are out in the community making referrals.
And you mentioned it's on our website, so they can download it, but we will actually personally deliver multiple copies of this for your business, congregation, wherever you want us to bring them to, because the more people that know about it, obviously the better.
Correct. And again, they're very easy to read, family friendly, but we also have
there's more.
But wait, there's more. We also have a mobile app, which you can download on both the Apple and the Android platforms. Get all of that information right on your phone. One-click calls to the programs. It's just very simple, and there's a ton of information in the app.
Because in today's world, who has time or the ability to carry around this heavy piece of paper? We must have it on our phone.
Right. Always in the palm of your hand.
It is literally a great resource, though, because I can remember being out at the First Step Park giving out books, and I think I've told you this story. I maybe even talked about it here. And a parent came up to me, was asking me about a program, and I immediately thought of Supporting Families in Crisis Hibiscus program, who we've had on as a guest many times, but I could not think of the number. So I said, hold on, let me pull out my phone.
Let me find it.
Because believe it or not, I did not have this with me. So I pulled out my phone, was able to connect them with the information. I was the hero of the day.
That's not the only story we've heard like that. So we know that people are using the app to make those referrals, connect people in our community to those resources, and that's what it's intended to do.
Another way that you can connect with us, you know what I'm going to say?
I do.
Facebook. Believe it or not.
I do that.
Besides all your friends that you went to high school with, guess who else is on Facebook? We are.
We are.
And we post on there about every single day. We have some upcoming events coming up that we post on so that you can kind of get some insider information, but we also post tips and or resources for the community, and it's a good way to kind of have an interactive dialogue because people do message us on Facebook, particularly when they're looking for a program or they have a certain circumstance that they're trying to navigate. We're able to respond to them.
We did post a really cool article last week on Facebook that you actually brought to my attention that talked about the importance of fathers reading to their children. It was very interesting recent research that was done in Australia, but it talked about it's important for kids to have a relationship with both parents reading to them, but it specifically mentioned how impactful it was to have fathers that are reading to them aloud because the intonation is different and the cadence is different and what they're able to learn. It was very interesting. So check that out because it's a good article.
And if somebody's listening to, or watching the show and they're under the age of 30, we are also on Instagram. Just look up CSC SLC. We're also on there.
We are.
I've learned that Facebook is for people, I'm going to say our age and up, and I say our age generously, right? You're on the border, my age and up, and Instagram is for younger.
Yes. I enjoy Instagram because it's all...
Who's got time for words? Let's just post pictures.
All I look at on Facebook now is pictures anyway. So.
Yeah, it's, that's the kind of society we live in. Okay, all joking aside, I do want to bring up something, the importance of, we talked a lot about in this program about the importance of mental health, and Suicide Prevention Day had just passed. And if you, and again, I know we're keeping the show light, right? So that you're entertained and we're entertained and it's fun to do. But if you are in a place where you feel like you're alone and that you need somebody to talk to, you can call 211. They have people 24 hours a day that you can talk to, whether you're my age, I'm going to say older, my age, or if you're a teenager. Again, there is somebody out there, there is somebody to listen to you, and there are resources, but more importantly, no matter what time of the day, reach out and talk to somebody. Everybody's here to listen, and you can simply call 211.
And specifically for teenagers at 211, you can actually text now or IM. So they've made it very simple, and there are trained people on the other end of that are answering questions and helping people through their situations.
Yeah. It's a good reminder that that simple number 211. Do you know the text number off by chance? Yeah. We're not.
No.
We'll call. Yeah. All right, you have another announcement?
I do. So September is National Literacy Month, and one of the things that we are doing is giving books away. We like to give books away. We do it at several events throughout the year, but this month in particular, we've got a large group of community partners that are hosting basically pop-up giveaways for us. So we're going to be at a bunch of different locations. I'll show you this quick flyer, but you can find this on our website and social as well. We're going to be at a bunch of different locations over the next several weeks for about an hour or so at a time, giving away books. So find us, come see us. We hope that we've got a place that fits into everybody's schedule. Some will be morning, some will be afternoon, some will be Fort Pierce, some will be Port St. Lucie. But you can find all those locations there. And if you have a location where you think that maybe you would like to do this, give us a call at the office at 408-1100, and we'll try to fit you in.
And this is really part of our extension of our St. Lucie Reads effort, which again is trying to make sure that our earliest youngest citizens are reading and reading at grade level. We have, 67 little libraries, and this is kind of an extension. Everybody that comes, every family that comes to our little pop-up book giveaways, which are at random locations, but we do need to give a big shout out to PNC Bank because they have really stepped up.
Yes.
But every child is going to walk away with 3 books.
Yep, 3 books.
And the whole strategy is to make sure that households have reading material in there, because simple way to make sure that children are reading is that they have the materials in their households.
I always enjoy these giveaways, or like when we've done this sort of event at the stadium before, because kids are so thoughtful about what books they're choosing. So it's really fun to have conversations with them about what they like to read about and what choices they're making. So it's a lot of fun. So anyway, that schedule's up on the website.
All right, so we have a wonderful guest who jokingly, because we're trying to have fun and entertain, but lots of serious information, but we jokingly said that when she speaks, she has to do jazz hands.
But she would do it.
I
know her.
That's why I'm just reminding her, because I feel confident that she's going to.
So we were teasing her before the show started because she's been a guest on the show many times, but never alone. Today she's alone.
That's how you know you've graduated, and you're bringing your A game when they're like, you can do it by yourself.
All by yourself.
Notice how we have two of us. But
Still haven't gotten there yet. But we are really lucky to have one of the Department of Health school nurses, Elizabeth Pantano, with us today, who has, again, been on the show several times. We've talked about some specific things that you've been here with in the past. And your normal sidekick is Irvin, our pediatric dental hygienist, who it's odd to see you two apart. I know you spend a lot of time with him through that program, our pediatric dental program with the Hands Clinic. But today we're going to talk about school nurses.
Yes.
So,
we're leaving Irvin out of this one. We're
Irvin
just going
out.
right into the school nurses.
Skipping right over Irvin. But I think it's important to kind of talk about the role that school nurses play in the system, in the district, if you will, because you guys do a whole bunch of different things.
We do. We cover a lot of schools and a lot of children, all the children in St. Lucie County. And we are starting out this year with health screenings, and we do emergency action plans for children that have chronic diseases or health issues like asthma and seizure disorder, a lot of children that have diabetes, a lot of children that have issues in the county that need an emergency action plan so that they can be successful in school and stay in school.
So talk a little bit about those health screenings, because I know as a parent, I've already gotten letters that screenings are happening, things are already taking place. What kinds of health screenings are you guys doing with the kids in school?
Well, we screen children from in kindergarten, first grade, third grade, and sixth grade. And we do vision, hearing. For sixth grade, we do scoliosis, and we do height and weight and their BMI.
That's a lot of kids.
It's a lot of kids.
How many school nurses are there?
I'm one of 10, and then we have a supervisor that's fantastic, and we cover about 3,000 to 4,000 children on average, anywhere from 3 to 5 schools.
Wow.
Wow. That's a lot of kids.
I totally
feel like
remember.
I should keep saying
I'm getting flat. I totally remember the scoliosis check
I
in
do
gym
too.
class when I was in middle school, which would have been 6th grade
I do too.
or 7th.
It's a long time
I digress.
ago.
I digress.
But that's important, and for maybe parents who have, like me, just gotten those letters and knows that those health screenings are happening, what happens during the screenings, and then if a problem is detected, what sort of follow-up can they expect?
Right, we do screenings, and then we send a letter home. Actually, we'll send 3 letters home, and you were directed to take your child to their pediatrician or their eye doctor if they have one. If they don't have one, our phone numbers are on the letter, or they can call the clinic, and we can assist them with a referral. For children that don't have Medicaid or other insurance, we have programs like Hike and Vision program out of Miami that will provide a child with a free eye exam and a free pair of glasses.
Oh, that's awesome. You guys do have a pretty extensive network of partners, even local partners, that are able to assist in situations where the family may not be able to take care of whatever the issue is.
Absolutely. We do a lot of case management with all the children as well.
And it's important, and I think about like when my kids were young, all those years ago. But, a lot of times the school health screen is really the first pickup, if you will, if a child has any hearing issues or vision issues, which you may not really realize. They may be sitting in the back of the class and can't even see the board. So it's so important, not only just for the general health, but to help facilitate the learning, if you will.
Absolutely. It's difficult to learn if you have a hard time hearing or seeing the board and what the teacher is doing.
So if I know we're going to talk about some of your initiatives and stuff, but, I'm thinking about this because while we came to the studio, we had an employee who was out sick because it's now that time of year where everybody's kind of getting sick, and a lot of people are like, oh, my child's sick, and just a matter of time before you get sick. So if you could give parents any advice as far as ways or tips to stay healthy, particularly during the cold and flu season, what would that advice be?
Absolutely. That's a big part of our role in school health, is providing education for the children and for the staff members. Hand washing is the biggest thing. We need to wash our hands and keep your hands away from your mouth and your eyes and your nose. cover your cough. We're teaching our children to cough in their elbows, and you can ask them about that. They can
You don't
come
wanna
home and tell you
demonstrate
what
it?
they're learning. Absolutely, we teach them to cough like that in their elbows.
Like
And-
the Dracula vampire move, right?
Yes.
And sometimes I'll see them in the hallway and ask them, how do you cover your cough? And they're very proud to be able to show that. So ask your kids about that.
I can always tell when you've been by classes because my kids will come home and start telling me, just repeating to me everything that they've heard. So I know that message is being driven home at school, and that's really, it is. I had a friend joke on Facebook this week that both of her kids were diagnosed with strep. And she said when that happens, they should just automatically give the parent protocol for strep as well, because it's inevitable in a household that it's going to happen. We're already seeing, I think, a lot of illness going through
Yes.
schools.
And that's common. We also, part of our role is to track those illnesses or the symptoms in schools that may be a communicable illness. And so we track those, and we work closely with epidemiology and the health department to make certain that there's not anything communicable going on that we need to know about and intervene in.
So obviously when people think about nurses, they think about medical, they think about what I think about, like the flu and, shots and screenings and all that. But a lot of what you've been focusing on, not just you, but the health department and really this community is nutrition, school nutrition particularly.
I was going to let you introduce it, but I think this is it's just a cool thing that's happening in not just our community, but in other communities as well. This special initiative that you guys have that's working not just in the schools, but with lots of community partners.
Absolutely. It's a program called 5210, and it's 5 fruits and vegetables a day, 2 hours of recreational screen time or less, 1 hour a day of exercise, and 0 sugary drinks. And it's an evidence-based program out of Maine. And we are doing presentations throughout the community and in schools to promote this program. It's something simple. The kids like it. There are 5 daycare centers that are implementing this program. And children are trying fruits and vegetables that they've never tried before and exercising, and they love it. And there are 4 schools that we are teaching this program in, and we're working with a Boys and Girls Club for an after-school program with a 5210.
So repeat again. So 5 fruits and vegetables? Did I get-
5 fruits and vegetables a day. So,
Yeah, give me an example of 5.
so what did you have for breakfast today?
That's your
we ask the
question.
children, right?
Yeah.
So a lot of times, you can have a banana or blueberries or some sort of fruit or vegetable with breakfast, and then you count them, and then lunchtime. So it's really, I say, when you're at school, you really can get a lot of fruits or vegetables on your tray, and so count them, and the kids love that. And then what did you eat for dinner? And so it's a pretty easy way to get in 5 fruits or vegetables.
I'm glad she talked generally. I thought she was putting me on the spot there. I was like, I don't think I want to reveal
What exactly you
Is
ate for
coffee a
breakfast?
fruits?
don't believe
So 5 fruits or vegetables a day, 2 hours or less of screen time.
Recreational screen time, yes.
So that includes television, phone, iPad.
Yes.
Okay. And that's, for the kids that are listening and watching, which are obviously a lot, 2 hours a day, that's a lot.
It is a lot.
So this is a very general, easy plan
Yes.
for them. Yeah.
It's an easy plan.
1 hour of exercise.
Yes.
Which is smart. Right? And for the kids watching, again, you get double the amount of screen time with exercise. And I really like this last one, 0 sugary drinks. Because, I know soda and fruit juice and a lot of that stuff has such a high level of sugar. And I don't think people realize not only, the impact on, let's say, weight, for example, but like with diabetes and everything like that, it's so much, and we see it prevalent everywhere.
Mm-hmm. Absolutely. It's an easy way to do it and to promote water drinking and, to decrease those sugars and candy and things as well. We encourage to decrease the sugar.
So 5210, you're doing it at 4 schools, some after-school programs, some child care centers. If somebody's interested, whether it be a church or some other group that's watching, do they just contact you?
Yeah, they can contact the health department, the school health program, and we'd be glad to share that information with them.
I know that Sandy Mack in our office was sort of on we'll say the ground level of 5210 and really worked with you guys to do a pilot project and get that really moving through our community. And he talks very highly of it. And we if you ever see Sandy out in the community, he has a gallon or
Yes.
larger
Yes.
jug of water that he takes with him everywhere. And I've heard him talking to kids at First Step about how important it is to drink water when they're out playing or exercising or whatever it is that they're doing.
And I know you indicated that they could call you if somebody's interested, and I know they flashed it on the screen because we have the video, but for those of you listening on the radio, the number is 772-462-3800.
That's correct, yes.
I knew that.
Question mark?
I copied it off the screen.
That's a question mark.
But, I will say the 52110, the way that you've promoted it, I think I've seen you dressed up as a carrot? No, a green bean?
Yes,
What was it?
a carrot, a green pea.
Grape.
We have grapes. We have different costumes, and the kids love it. And the staff members all smile too when I come in as a carrot.
Of course.
We were actually in the Christmas parade, dressed up with the health department in our costumes. So look for us in the community and look for us in the schools.
Any chance to dress up as a vegetable is a good day.
Oh, duh, of course. So again, anyone that's listening, take that back with you to your group or whatever. 5210, 5 fruits and vegetables a day, 2 hours or less of screen time, 1 hour of physical exercise, couldn't think of it, and then 0 sugary drinks. And it's a smart way to implement it. Now, we said we weren't going to talk about the dental the whole dental program, but Elizabeth is really the reason why we have a pediatric dental program in St. Lucie County, particularly one that is going out to a lot of, if not all, the elementary schools and child care centers, is because of the work that you put in your job, noticing a lot of kids, particularly in 2 schools. I remember you giving that report, if you will, that there was a lot of dental decay, and it was affecting not only the child's health, but also their behavior.
There are great things today going on in the dental department. The Irvin with the Hands Pediatric Dental Program is going out, and they are screening children, and they're doing sealants for children to prevent cavities. And the health department has Fatten going out and doing screenings and sealants as well. So many of the schools, in fact, I believe most of the schools will be covered this year through dental screenings, and they're doing referrals and follow-up with those children and emergency cases they're seeing. So fantastic things are going on. Gets better every year.
You're being very humble about this program getting started.
I totally set her up to talk about all the amazing work she did, and she didn't bite.
She wouldn't do that. But this was really something that you identified kids were struggling with, and not just some kids, but lots of kids in our community had a significant amount of dental decay or issues that were going on, that things were going untreated. And whether it was either a screening that had happened or they hadn't even been to the dentist once they were coming into school. I remember well when you came and did the presentation to the roundtable and to the Children's Services Council board, and talked about how significant some of those issues were and what those kids were really struggling with, because they're in pain. Like, we know as adults how painful it is when you have a tooth that's hurting you, but to imagine a child trying to make it through a day of school and being expected to function and perform and do tests and all of those things with that kind of pain, knowing that before this program was implemented, there was nothing in place for that. It's just really amazing to see what has happened.
Well, the entire community really came together to make this happen. As a school nurse, we kind of suffered along with the children because it was difficult to not have a place to refer the children, and now it's just run so smoothly, and there's no problem. And the community came together to make it happen, really.
And I think it really speaks to, you said there's 10 of you all together, right? 10 nurses?
Yes.
School nurses. The fact that, obviously they do their job, they do the screenings, they help with children that have medication, all that stuff, but they're really kind of, I won't say front line, but they're kind of in the trenches, if you will, and you see what's going on. And because we have such an active school nurses and they're so involved in the community, that dialogue was able to happen, as opposed to, them just doing their job and never saying anything. And that's a big attributable to your leadership, to the health department's leadership, and really, it's something to be proud of in St. Lucie County. Not that we had it, but that we were able to react to it.
Well, and I think too, 5210 is another example of that, because you guys were identifying that there was a significant increase in the number of children that were ranking high on their BMI, and we're really looking for a way to find something to give to them to help them counteract some of those things.
Absolutely. Part of our role as school nurses is to be the voice for the children, and we are a voice for those children.
So let me ask this question, because we got a couple minutes left, and I'm just, I'm a little slow on the intake. Maybe not as much coffee as I wanted, but there's 10 nurses, there's 40,000 school kids, so about 4,000 per school nurse. There's no way that you can be everywhere. So do you have like nurses' aides or anything that kind of help out?
Yes, there are unlicensed assistive personnel in every clinic. So a health aide is in every clinic. And then there's a nurse, a registered nurse through the health department that covers each of those clinics.
Oh, nice. So you're kind of, because how many schools do you have? If you have 4,000 kids, that's probably 4 schools?
I have 3 schools right now, and I'm covering a school as well. So 4 schools right now.
Right. So you're kind of...
Just a few.
Yeah, I'm surprised she has time to do this show because she's running around everywhere. But
she's leaving to go do screenings, I heard.
and I will say just kind of the history of it and how the Children's Services Council became involved with school nurses, because we're very proud to say that we're one of the funding partners. Is Larry Lee, who used to run the health department. Actually, at one point there was a school nurse crisis, and he spoke to us and the county, and we kind of both leveraged each other to enable kind of like a foundation of school nurses. And then under Clint Sperber's leadership, we kind of upped it again. Very well done, Clint. Very well done. We kind of upped it again. So, big kudos again to the health department and to the county, and obviously the Children's Services Council, because in order to have the school nurses, we all have to work together and help fund them.
And I think it is important to note, you have 4,000 kids now. There was a time when you had more than that, when there were fewer nurses to sort of be shared throughout the district. So we're grateful that there are 10 of you.
Absolutely. It's a busy job. We stay busy it's a nice to have summers off, because when school starts, we're running.
Yeah.
All right, so advice to parents: limit sugary drinks, limit screen time, make sure they have physical exercise, and wash and wash your hands. Oh, I'm sorry, and obviously eat the vegetables, fruits and vegetables, and wash your hands.
Absolutely. That's great advice to stay healthy.
I think I wash my hands so
You
much,
do.
particularly during this time of year. I'm surprised I have fingerprints left.
Sean, if you ever watch Sean, as soon as he shakes someone's hands, he'll immediately turn around and wash them. He's very good about that.
I talk with my hands. I do a lot with my hands, so I know that I need to keep them clean.
That's good. It's a good habit to have. It's very good. But again, we covered a lot of different things. There's a lot of ways that people can get in touch with the Department of Health. Facebook, website, the phone number that you gave out, 462-3800. Lots of ways to stay connected to what all you guys are doing in the community as well.
Absolutely.
And again, 5210. Now, I do have a clarification question. I'm stuck on this 5 fruits and vegetables. So if I eat a grape, a banana, a strawberry, help me name some other fruits.
Really?
That counts as 5, right?
You have to eat a serving, Sean.
Oh, okay, there we go.
Entire serving.
That makes more sense.
So maybe we'll get a list from Elizabeth and you can experiment with some new fruit choices.
What I'm thinking is, and I know I'm not the only one, I got to step up my fruit game.
You do.
Fruits and vegetables. I do eat a lot of vegetables. So
You do.
I do eat a lot
You
of
can keep
vegetables.
track of it this week and then report it to us in the next show.
Challenge accepted.
All right, I will do it. Thank you so very much for coming on. We greatly appreciate it.
Thank you. I'm going to have to do it.
Yes. Get the jazz hands in. Yes. All right.
I like it.
That's our radio and television program. Remember, it's a weekly radio program on 104.5 The Flame. And remember, it's our children, our community, our future. We're all in this together. We'll see you next time.